Hey everyone, Dr. Ryan, physical therapist here. Today I'm going to go over how I like to explain the use of blood flow restriction training with my patients. Just so that you know, this is tailored to every patient and is really individual. So I'm going to use an example, but I change this based on what the patient's condition is and how it equates to that portion of their body, what their profession is. Sometimes, the person may be a medical professional and may already have some understanding of what this is, or, they're an engineer and they really like to get into the nitty gritty of details and numbers and things like that. So this is certainly going to be very generalized. But what I'm going to do is take an example of a lot of patients that I've had recently where we've been getting great success using blood flow restriction training, and as a common scenario that I am explaining this to my patients. So let's take, for example, John, who has knee arthritis. We just did a full evaluation with John, and I'm always, making sure I'm doing a full evaluation before discussing this with my patients, properly screening them medically, which we can go over in another video, and making sure that this is going to be appropriate for them, but also looking at a full body movement screen, watching them walk, squat, go downstairs, be able to do day-to-day things, and seeing how their body is affected. So, for example, with John, who is not a real patient, but someone that may have knee pain, I would say, hey, John, look, you are looking great overall. The first thing that I want to talk to you about is, you are telling me that you came to me with an x-ray from your doctor saying that you have knee arthritis, but your pain just started 2 weeks ago. So the first thing I want you to realize is that knee arthritis is very common and it's not something that develops overnight. So your pain recently started within the last 2 weeks, but knee arthritis is something that happens over a lifetime of using our bodies. And it is quite normal to get some degree of knee arthritis. In fact, many people do. And it doesn't always necessarily mean that you have to have or are going to have pain. So a really good way for us to assess this is seeing that you have a lot less strength in your knee that you have the arthritis in compared to the other knee. And it's a little bit of a chicken or the egg situation, but what we do know is if we improve the strength of your quadricep muscle in that knee, it is very likely to help decrease the pain that you're experiencing from your arthritis. And it's even possible that arthritis may not be causing your pain, but it may more so be, the current level of inflammation you have from increased workload or that decrease in muscle strength, or the fact that you're not straightening your knee all the way currently. So what we're going to do is help straighten your knee a little bit better, but we're also going to help improve your muscle strength. And you might be wondering, well, how are we going to do that if every time I try to do something with my knee, it hurts? So that's where blood flow restriction training can come in. And what blood flow restriction training is essentially allows us to make improvements in muscle strength and size with a lot lighter weight than typically we otherwise would have to use in order to make those same improvements. So, John, for example, if we are doing a leg press exercise, typically we have to use about 65% or more of a 1 repetition maximum. And a 1 repetition maximum is how much weight you can press one time on the leg press. And there are ways for us to estimate this and without having to go through and doing it. But for you, even at 65% of that, that would probably cause you a little bit of pain right now. So what we're going to do instead is with blood flow restriction training, if it's something that you're interested in and are able to get through a couple rounds with comfortably, then we can use as little as 20% of a 1 repetition maximum and make similar improvements in your muscle strength and size and be able to do that without as much knee pain because the weight is a lot lighter. Now, that's not to say this is going to be easy. It is challenging to perform and a little bit uncomfortable, but more so you're experiencing discomfort from the cuff being around your leg and from the blood building up in your leg and just feeling very tight. You're not going to feel as much of that knee pain during the leg press that you typically would if we're using higher weights. So what we do is we get a tourniquet and wrap it around your leg. And that tourniquet inflates just like a blood pressure cuff. And what it's doing is it's finding what your personalized pressure is going to be that is required to cut off blood flow to your leg. We then use a percentage of that during exercise so that we're fully occluding blood from returning back to your heart from your leg, so it's getting trapped in there, but some blood is still going through. And what this does is it fatigues the muscle a lot quicker than it otherwise would get fatigued if we were using that heavier weight, and we're doing it with less weight. So those muscles are using energy as you're doing the first few repetitions and as you're getting through the first set or two. It's using a lot of energy, but it's not getting new energy from more blood flow to the leg. And the byproducts from using that energy. So when you're exercising and you feel that muscle burn and that um, the lactate buildup, I'm sure you've heard that term, is where you're getting all these byproducts from that muscle using energy. And typically, those go back to the rest of your body and get processed, and new nutrients come through. And that's why we rest and why you're able to do multiple sets of an exercise fairly easily. But when those byproducts can't leave the limb, they're getting trapped in there. So they're creating this environment in which the muscle's getting really tired really fast, and the muscle gets tricked into thinking that it's lifting a lot heavier of a weight than it actually is. So the muscle then goes, once we're done with the exercise, we release it, the blood flow goes back to normal. That muscle undergoes a reparative process as if it was just lifting heavier weights, and it starts to improve muscle strength and muscle mass if it's done consistently over time. Typically, this is something that we need to do at least twice a week and can be done anywhere from 4 to 12 weeks, depending on how quickly you're able to initiate and how quickly you respond to it. So some people, it takes 2 weeks just to ramp up to that proper load that we need to get a stimulus of building strength. And that's okay, because we want to make sure we're doing it safely. If we do too much too soon, that's where we can run into safety issues and where people can get injured or hurt. But that's not something that we're going to do. So if this is something that's interesting to you, we've already determined that you would be medically appropriate to do so. We can get started with it today. And would you like, if you're able to, in, let's say 2 months from now, be able to go up and down stairs or squat to the floor with much less or no knee pain? I'm sure you would. And this is one way for us to get there. There are other ways, but this is going to be a little bit less pain on your knee itself and allow us to potentially move a little bit quicker in that process. So that is typically how I'm explaining blood flow restriction training to my patients. Obviously, it's going to be different for different people, or if it's a post-op patient versus someone with knee arthritis in this example. But I hope you guys found this helpful. If you did, like, subscribe, and comment below if you have any questions. Thank you.